Hello. Today we will be talking about an article that was recently published in Developmental Medicine and Child Neurology. I'm Peter Kang. I'm a pediatric neurologist at the University of Minnesota. The title of the article is Clinical Electrophysiological and Imaging Findings in Childhood Brachial Plexus Injury. What this paper adds. In summary, we have developed a new scoring system to quantify the results of electrodiagnostic and magnetic resonance imaging studies. We found that severity of denervation on EMG has good prognostic value for brachial plexus injuries. We also found that composite EMG scores have good prognostic value in this setting. And lastly, that brachial plexus MRI has good prognostic value for these injuries. Let's go through a little bit of background. Brachial plexus injury in childhood can be divided into two general categories. The first is brachial plexus birth injury, known as BPBI, and the other is postneonatal brachial plexus injury, which can be from a number of different causes, including trauma, inflammation, and infection. Prognostication for BPI remains a significant and controversial issue. We compared the prognostic value of three different measures in the setting of BPI in childhood. This was a single-center retrospective cross-sectional study performed at the University of Florida College of Medicine. We looked at children with BPI who were evaluated in our pediatric EMG laboratory and compared the prognostic value of the following three measures: the active movement scale, the AMS, which is a clinical outcome measure, the MRI of the brachial plexus, and electrodiagnostic studies, including nerve conduction studies and EMG. We looked at 21 children with BPI. Among these 21, there were 30 electrodiagnostic studies performed, including both nerve conduction studies and EMG, 14 brachial plexus MRI studies, and 10 surgical procedures relevant to the diagnosis. Several measures were found to have a high prognostic value. They include brachial plexus MRI, EMG denervation score, and total EMG score. Let's look at figure 1 from the paper. This figure focuses on the MRI score in surgical versus non-surgical participants. And you can see that there's some overlap in the values between the surgical and non-surgical participants in terms of scores. However, if you look at the individuals who had the lowest scores, meaning the worst findings, they tend to cluster in the surgical category, meaning that these patients required surgery. In figure 2, we looked at total EMG scores. And again, you can see that there is overlap among the scores between the surgical and non-surgical participants. However, you can see on several of the panels that the very lowest scores, meaning the most severe findings on EMG, tended to cluster in the surgical participants. And then lastly, in figure 3, we combined the scores we obtained for total EMG as well as MRI. The highest number indicates the best prognosis and the lowest number indicates the more severe prognosis. And you can see again that the more severe cases tend to cluster among the ones who have surgical needs. So overall, our findings are that brachial plexus MRI scores, EMG denervation scores, and mean total EMG scores provide the most accurate prognostic information. Our recommendation is that for BPI in childhood, both MRI and electrodiagnostic studies that include EMG should be performed to yield the most accurate prognostic information. Thank you very much.